Yes.
Okay, great. So my name is Emily Balog. I'm from the Rutgers Occupational Therapy Doctoral Program. And today I'm going to talk to you about the research I did on aging in place and empowering community participation. So I'd like to thank Transform South Jersey. It was because of them that I was able to conduct this research in 3 communities in South Jersey, and also the Pat Tillman Foundation. I'm a military veteran, and I received a scholarship from the Pat Tillman Foundation to do this research. I want to start with a quote from one of the participants in the study. In addition to being served, seniors, they like to feel as if they're needed, as if that someone needs their help, even if it's going out to schools and reading to the students. Because without a doubt, seniors have a wealth of knowledge. They have information that they can pass on. And also, I guess, it's just part of being a human being. You also want to feel needed. You need to feel needed, feel valued. That adds to your own personal well-being also. Seniors, as well as various kinds of services coming to them, they also want to feel as if they're needed. So I want to provide you a little bit of background to why I did this study. 96% of older adults in America desire to remain in their homes and communities safely, independently, and comfortably, regardless of age, income, or ability level. And this is called aging in place. Baby boomers are steadily aging in America and represent an increased population in nearly every sector. In suburban communities today, older adults make up 51% of the population. 95% of all older adults live in community settings and have expressed a desire to avoid costly institutionalization and to remain in their homes and communities. Again, what we call aging in place. Now, older adults in moderate income suburban communities are increasingly at a higher risk for institutionalization should their health or finances decline, because the access to their wealth is often within the home in which they dwell. And so this process forces many suburban dwelling older adults to liquidate their assets or go without critical services. And this is a really demeaning process that completely negates the vision of aging in place. Much of the research has focused on rural communities and urban communities. And so I felt it was really important to address this issue within suburban communities. So aging in place services are not only preferred by older adults, but they're also shown to be a more cost-effective solution to institutionalization. Older adult participation in community life is shown to enhance aging in place and to enrich communities. Fortunately, communities have recognized the need for action planning to support the needs of older adults to age in place. However, these plans often lack empirical evidence. They leave out older adults, particularly those with disabilities. And the planning process takes a top-down approach, often from the perspective of planners and policymakers. So as an occupational therapist, one of the things that I often focus on is participation, because we know that that is a key ingredient to aging in place. Communities can create cost-effective, theory-driven aging strategies, but older adults, especially those with disabilities, need to be included in this process. So the goal of this research was to really find the best processes to empower older adults to participate in their communities, including planning, by understanding their needs and ideas from their point of view. So my research explored the ways that older adults can provide insight into a theory of change for engaging older adults in 3 suburban South Jersey communities, and in order to embed this perspective into community action plans. So these are the results of the study. I conducted surveys with 64 older adults within these 3 communities. And what I asked about was community characteristics that existed, individual characteristics, and how satisfied these individuals were with their participation. And what the findings, the quantitative findings show, which is here, is that it shows that those with that functional ability level, that information to programs, services, and events, and that healthcare services affect satisfaction with participation. So what that means is that functional ability level, that means, how independent are you both physically and mentally? And does your community provide information to program services and events where you can get involved? And are there available healthcare services? So this shows that I also did a secondary analysis that showed that there was an association between functional ability, outdoor mobility, exercise, and day trips. From there, I did a qualitative interviews with select participants, 14 individuals. And what they found was that there were these sort of three categories that need to be fulfilled. There are basic needs, there are social needs, and there are growth needs. And I just want to share a quote from each. So in the basic needs, participant 1 or 11 shared with us, from an aging perspective, some of the things I would like to not have to stress over is A, finding people who can help do repairs, finding people who can help maintain your property. So those are the kinds of things I mean by basic needs. You know, do you have food? Do you have shelter? Those are critical, but also, are you able to maintain your property? So that was the basic needs. And then the social needs, I want to provide a quote. Some of these projects, yeah, they serve a purpose for sure, but almost an unintended consequence, they foster community. And then the growth needs. I think it's my need to be needed. So I think so often we think about developmentally how people experience life, and we sort of leave out this idea that older adults can still have this developmental growth. And that is often to give back to society in some way and to feel that they're needed. And so what I then did was, because this was what's called a mixed method study, I took the results of the quantitative, and this is just a sample of what I did, and the qualitative results, and I looked for sort of patterns within those in order to develop a larger kind of inference. And so, again, I'm not going to bore you with all the nitty gritty details here, but what I did was map these to an implementation framework where the needs were identified and the objectives in order to meet those needs were identified all by the participants, and then the outcomes that would be expected if we met those needs. So things like those basic needs that I had mentioned, some of the things that came out of that were if we were able to provide things like outdoor spaces or better transportation systems, that would result in something to look forward to and a more inclusive community. And then those social needs, if those were addressed, then, oh, I'm sorry, I read the social needs first, apologies. So those basic needs were food, safety, activities of daily living, and then also something we call instrumental activities of daily living. And those are the things like taking care of your property, being able to change a light bulb, things like that, cleaning your bathroom, cooking a meal. And so if those were addressed through services like home and community-based services, the outcomes participants felt would be that they wouldn't have so much worry or stress or fear, and that they could actually have a service created within their communities. And then lastly, that growth piece that I had mentioned about, the needs are to have this meaning and purpose in life, even in older adulthood. It's not just something that's important to younger adults or children. And this idea of giving back and helping others and socialization, if those things were addressed, through outreach programs, through groups, through senior centers, things like that, that the outcomes would be this idea exchange and innovation. And so the overarching theory of change, that final result that came from this, is that older adults are empowered to participate in their community when there's support for basic and home living needs, when options for participation match their level of ability, interests, and values, and when they're invited and know where to find information about programs, services, or events. And so what we did was we collectively took all of that information, all of those results, and worked with the stakeholders within each of those communities. And those really included sort of the champions, which are individuals who sort of dedicate themselves to making change. And so working with each of those community liaisons and champions, what came out of that meeting was that what's needed is leveled engagement. So people present with all different ability levels and time ability, things like that. So providing the opportunity at a varied level. So for example, maybe it's a meeting that you can go to virtually, or maybe it's something that you can go to either once a month or once a week, those sort of things, providing those different levels so that engagement can occur. And then also communication and information. It's a real problem, particularly I neglected to say that this research was done during the pandemic. And so getting information out to older adults was a real challenge, not just for this study, but for, related to the pandemic. So better streams of communication that can be available virtually and physically, and that they match, that if you see a flyer hanging in a grocery store, that's also published on the website, and then that's also mailed to your home or emailed to you, for example. And then this idea of enfranchisement and champions. And what this means is that once you know about this information, that you have choice in whether or not you want to participate in it, but that you also have people who are saying, hey, these champions are saying, this would be really good for you. I think you should come out and enjoy this activity, for example, or help us with this planning project. And then ultimately, during that stakeholder meeting, this whole entire process of being involved in planning in the community would result in both social and cultural capital, and to really sort of bolster that capital, meaning, sort of that glue that brings people together. And so this was sort of the overarching model that was developed from all of that work, so that communities can now focus on, these particular communities can focus on developing plans that address these needs in multi-level ways, so that all ability levels are included and can participate in both the planning and the participation in their communities, and that this brings meaning and purpose to their lives and demonstrates the symbiosis of meeting needs and being needed. Because without a doubt, we need to value older adults and support their need for community participation. So what's next? As I mentioned, that was just a theory of change. So these were the ideas, and now we need to get to action. And this is sort of the whole crux of implementation science and translational science, is what processes are needed to actually bring this action forth. And so I'm currently working with the Rutgers School of Nursing to develop what's possible to provide to these communities. And there was a real strong interest in a home and community-based service. And so we're exploring those possibilities now. And then I'll be returning in the coming months to those 3 communities to help develop these programs and services. So thank you. I'd love to hear any questions or comments that you have. My email is there.
Question.
Sure.
What communities did you work with, and how were they defined?
So the 3 communities that I chose were part of Transform South Jersey. Transform South Jersey, who Andy Frazier is here with us today and also presenting in the 3rd slot, but their organization was a grantor to 6 communities in South Jersey. And so of those 6 communities, I was seeking out middle income, because if you recall, I wanted to look at really, it's not just homeowners, but oftentimes homeowners, and sort of those 6 communities, 3 of them met that middle income criteria. And by middle income, I mean of the community. I didn't ask each individual because that's really private information that people don't often want to share. And so the World Health Organization recommends that you look at communities as a whole and see what their income levels are. And so I was specifically looking at those middle income communities.
So where did you go to their homes, or where?
No, I didn't go to their homes. So what I did was I created a telephone survey. And so I used the liaisons were a tremendous support. Because this was done during the pandemic, I had to be really careful, because my biggest concern was this is the most vulnerable group of people right now during the pandemic. We're talking 2021. And so I was very concerned about the health and well-being of these individuals. And then there was a huge spike in fraudulent calls over the pandemic. And so I was very concerned about just cold calling people and saying, hey, do you want to take this survey or participate in this study? Because honestly, the phone calls I wanted them to get were about getting vaccines and where vaccinations were available. So I had to be very careful. So I worked with the liaisons. I worked with a lot of community groups to identify individuals who then would call into this survey. So that way nobody was pressuring them, to participate in that way. And then within that survey, it had a question, would you be willing to follow up with an interview? And so those were the ones I selected for the interview process.
Thank you.
You're welcome. Thanks, Maria. Yeah, Liliana.
Hi, good morning. Thank you for, so I am curious if you've gone this far. So I work in a community that's a little more affluent. Nonetheless, the needs are there as this
Absolutely.
aging, of course, like you said, everyone wants to age in place and they want to remain in their homes. But then, of course, the challenges are as you get older, if you had a surgery or you fell or something, how to bring out the recyclables, how to bring out the base. We're talking even about the very basic things, the garbage, nothing. So are seniors willing to pay for these services, or are we looking at just the volunteer community, nonprofit, or it might still be slightly cheaper or cost effective than moving into an assisted living, which everybody avoids at all costs, and the fact that it's extremely high. But then there's also a reluctance about selling their homes, which
That's right.
for 40 years or 50 years, right? And
That's
so
right.
so are they willing to pay for any of the services? Do you know? I mean, I'm sure in more.
It's not about willingness. I think what the findings are really showing, and really what other research has shown, is that, there is no extra income. You're on this fixed budget and you're paying for your home potentially. And so to have to bring additional monies forward to pay for example, an aide to come to your home and help you to bathe, or to clean your home, or to make a meal for you, or to take out your trash, a handy person to, fix things. That's a lot of money. That's a lot of extra income that's just not available. And the only way to make that available most often is to liquidate the assets within your home, either meaning selling it or do a reverse mortgage, which then, leaves you no wealth to pass down to family members, right? And so one of the things that I'm additionally doing that was not part of this research is, advocating to politicians that we need a funding stream to come directly to communities. And so unfortunately right now, the only way that I can see that happening is through grantors and providing, grants so that these services can be developed. And that's actually what I'm in the process of trying to do, because there's a huge interest in this home and community-based service aspect, which is something that's feasible for us to develop and provide. So what I'm hoping to do is work with the School of Nursing. And then of course, I'm in the occupational therapy program, because there's an existing study called the Capable study that looks at, that has an occupational therapist, a nurse, and a handy person that go out to individual homes and provide them with recommendations for home modifications, for example. And by doing those things, it costs a few $1,000s, which is it's very inexpensive for some of these modifications. Those modifications could actually be made by that handy person. And then also other health issues could be addressed by the nurse. And there's fantastic results. It's something like 96% of participants have improvement when participating in these services. But we need to take it one step further, because you can see it's not just about your basic needs, your basic self-care. And while that's incredibly important, what these findings really showed is that we're talking about the home itself, mowing the lawn, plumbing, if the plumbing goes wrong, taking out the trash and recyclables, those sorts of things that are causing people to have to move out of their home, move out of communities, longstanding or not, and into institutions.
Thank you.
Hi,
More
Kathy.
interested about that Capable study, if there's any way that we can.
Yeah, absolutely. You can find it super easy on Google. I'll try to link it in the chat, but it's Capable, all capital letters.
Thank you.
Sure. Kathy, did you have a question or
Yes,
comment?
I did. I just wanted to speak about North Jersey villages and the village movement. Very much parallels everything that you speak of, because the whole goal is to empower seniors, to engage them in creating an environment in their community that enables them and also makes it more affordable for them to age at home. And it's the very basic things that meeting the needs of transportation and of maintaining your home, involving intergenerational, but very much first focusing on what the seniors are able to provide for themselves. And that's really the whole focus of the movement.
Yes, I love that, Kathy. And a lot of my literature review included, the village model, the naturally occurring retirement communities, or NORCs. What I love about that is that it's empowering older adults to come up with the solutions themselves, right? Because what happens so often is that healthcare providers, policymakers, we all come in and say like, oh, this is what you need. This is what we think you should have. When in reality, perhaps some older adults can solve the problem together amongst themselves, as you mentioned, with these village communities, maybe providing transportation services to one another, for example. So I think that's really critical, and both transportation and intergenerational collaboration were findings of this study as well, my research as well. Transportation is a huge problem. I would love to tackle that. I don't have the capacity or qualifications to address that, which is the only reason that I'm more so developing the home and community-based service aspect, because suburban communities have a really interesting challenge with transportation, right? Like in urban communities, it's certainly more accessible. I'm not saying that it's so easy. And then in rural communities, you're incredibly isolated and far away. But in suburban, you're sort of just far enough away where you can't walk. And so, many people in suburban communities really rely on their own independent driving. And so that was like a really big fear, is losing your ability to drive.
And now with the post-pandemic, a lot of people are concerned about shared driving, sharing rides and providing rides. So getting the volunteers to fulfill that need becomes more and more difficult.
Right. And
there's a challenge.
And there are, we do have Access Link, and we have these, some communities have these shuttles and things like that. And I think those are all good starts, but the outcomes that I was finding is that, they're really inefficient. And, how good are you going to feel if you have to spend 6 hours just to do one doctor's appointment, right? How are you going to participate in your community if you're out all day waiting for them to come back and pick you up? Or you can't just hop in your car and go. There's a lot of independence around driving yourself. And when you're relying on other people, there's so much planning involved, and that is mentally taxing. So there's a lot of issues with transportation. I admire the shuttle ideas, but again, those still have a lot of the same issues.
Right. I would love to work with you on introducing the village movement as an option.
Oh, Kathy, please send me an email. And I would love to do that also. The more people that we have involved, I think the better, because we are not going to solve this issue as a standalone one person, saving the day or coming up with some miracle idea. This is going to take community efforts. This is going to take collaboration from lots of different people. We have 50 seconds. Anybody else want to comment or question? Eileen, did you?
There's one such statement. Liliana asked about whether seniors are willing to pay for services. I think one of my biggest struggles as a senior is that contractors and workers that I worked with are no longer in the community, and I don't know where to look for new people to do work. So it would be nice to have a resource of reliable, trustworthy folks who can provide these services. And for seniors like myself, those are services you paid for pretty much as long as you lived in your house, and would be willing to pay for them going forward. You just don't know who they are.
Yes, and that was also one of the findings of the study. And in some communities that